Hello, and thanks for tuning in today for what we hope will be a useful discussion. My name is Arianna Galligher, and this webinar series was developed for you by the STAR program here at OSU. The series is meant to take a deeper dive into some topics related to exposure to stress and adversity. And maybe more importantly, the goal is to introduce some strategies for how to cope more effectively. Today's topic is going to focus on understanding some common responses to trauma, and we're going to get started right now. So first, let's talk a little bit about a couple of definitions. We want to talk a little bit about what we mean when we say crisis and what we mean when we say trauma. So crisis is going to be any time that a person or a group of people is working to deal with a time of intense difficulty or trouble or danger. Sometimes crisis can also lead to the experience of trauma. Trauma is going to be any event or series of events or set of circumstances that someone experiences as being physically or emotionally harmful or potentially life-threatening. As a result of those experiences, there are some lasting adverse effects. So when we're talking about trauma, we're really talking about dealing with the aftermath of whatever you've been through. As human beings, we tend to respond to crisis or trauma in some fairly common ways. Some of us are going to have the instinct in certain situations to fight or to confront that situation. Some of us experience flight. That means we might run away from, avoid, escape a situation. Some of us are going to freeze. We might feel stuck or paralyzed by the situation. And still others of us might experience fold. Think of folding a hand of cards where we're going to give up. We're going to say, nope, I can't. And it's going to be hard to move forward from there. So just to give you some context around an example, imagine for a moment that you are taking a walk in the woods. You're using all of your mindfulness skills to notice everything about your surroundings, and suddenly you hear rustling off to the side of your path. A stick snaps and a bear emerges right in front of you. Now, most of us would agree that being confronted by a bear in the wilderness represents a crisis situation. You know, most of us are going to react with at least a jolt of adrenaline, and we're going to think that this is a serious situation that we're going to have to make some pretty quick decisions about. And it's an appropriate time that we might experience some of these instincts that we talked about. So know that whatever your response is, it's your brain's it's your brain's desire to help you survive. So some of us might experience that instinct to fight, particularly if that bear demonstrates signs of aggression, and maybe you're accompanied by somebody that you really care about. So you might feel protective and want to keep that other person from harm. So an example of fight in this situation might be to kind of square off your body, make it appear as big as it possibly can, make loud noises, just kind of demonstrate to that bear that you are more trouble than a confrontation would be worth. In some situations, a person might experience that flight impulse. Depending on your proximity to the bear, if you're far enough away and escape seems possible, some of us might try to expand that distance between ourselves and the bear. Some of us might freeze. If you sense that any kind of sudden movement might further escalate the danger, you might just stay put. Don't move, just breathe. And some of us might experience that fold impulse. You might want to signal to that bear that you are not a threat, so you might literally crumple into a ball, cover your head, and play dead. So I just want to validate that whatever you do in this situation to manage it, remember that the goal was survival. and you had to make some split-second decisions based on the best information that you had in the moment. Now, let's step outside our example for a minute and think about how this might apply, for example, in the workplace. Many of us have to confront crisis situations throughout our day and make split-second decisions based on the information that's available, and it might not always have a complete picture. So these are real crises that we confront on a daily basis, and many of us are raised and socialized and in fact trained to take responsibility for outcomes. Now, that's not necessarily a bad thing, and we certainly want to acknowledge that taking some ownership helps us strive for excellence. But it can also lead us to blame ourselves unfairly when things don't turn out well, even if we really didn't have control over the outcome. It can also keep us quite distant from our own emotions if we're sort of taking ownership of things that actually don't belong to us. It can lead us to sort of distance ourselves from the grief that we might feel in response to an outcome that perhaps we weren't expecting and certainly we wouldn't have wanted. So a common mistake that gets us into trouble, especially if our decisions in the moment perhaps led to a less than ideal outcome, might be to play that woulda, coulda, shoulda game after the fact. We want to do what we can to limit that. It doesn't actually serve us well in the long run. So instead, it might be worthwhile to try to develop a more balanced perspective. So you might ask yourself, is it possible to give myself credit for the effort, even if I didn't get the outcome? Is there anything that I can learn from this situation that might help me in a similar circumstance in the future? And what do I need to do right now to be able to cope with my disappointment or grief? I think taking that pause to acknowledge that those feelings are present, it really highlights the importance and the gravity of the situation. We are human, and we're going to have an emotional response to a crisis situation. Having said that, I think it's also important to think about how you want to cope. You know, a lot of people really struggle to acknowledge their own emotions, in part because it's difficult to know what to do once you've opened that box. So as you're processing those feelings, those very typical, normal emotions that are to be expected, if you find yourself wishing that you'd done something differently, try to remind yourself that maybe you did the best that you could, given the circumstances, some of which may not have been ideal. It's important to remember that sometimes bad things happen even when you or your team did everything right. And it's important to validate for yourself that it's okay that you're feeling upset. It doesn't mean you're bad at your job. Know also that adrenaline is a really powerful resource. It can help us get through a lot of different challenges without breaking down. The problem is that adrenaline is pretty short term. It's meant to be short term, just to get us through that crisis and on the other side of it. So when that adrenaline runs its course, it's really natural to notice sort of an emotional residue, that it might lead us to doubt our actions or our efforts or our decisions in the moment. So what goes up must come down, and this is sort of to be expected. It doesn't mean that you're damaged. It means that you're human. And sometimes you think you're coping really well with something and it hasn't really made an impact, but all of a sudden you are surprised by emotions that you didn't even know were there. You might find yourself feeling a little bit extra irritable or on edge or bothered by things that typically wouldn't be any big deal. You might find yourself feeling tearful or a little bit withdrawn. This is common. It's important to recognize that that doesn't mean that you're broken or you're damaged, and support is available. So that's one of the things that the STAR program was designed for. We're proud to offer this resource as a support, and know that if you'd like some additional resources and you're relating to this material, we're here. All you have to do is call 614-293-STAR and get linked with a peer, a professional, licensed professional peer that can help walk you through what is typical to expect while you're working through a crisis situation, and give you some tips for how to cope most effectively. Thanks for tuning in, everybody. Take care.